Uh, Good morning, everybody. I promise I won't take much of your time. New landscape of diagnosis of Alzheimer's disease. There are two types now we know about Alzheimer's. There is clinically diagnosed one, and the one is diagnosed with the biomarkers. So far, the biomarkers market is not that famous. It's starting coming now in 2021, and it's increasing. So you can diagnose Alzheimer using the biomarkers, not waiting for the clinical entity or clinical diagnosis. So without biomarkers, by age of 65, around 4 people per 1,000 person. So every 1,000, 4 people would develop Alzheimer by age of 65. But as you grow older, this percentage triple or even quadruple. By age of 70 to 80, the number will be around from 36, 40 per 1,000. So the number increasing. And just bear in mind, this is clinical diagnosis, not biomarker diagnosis. So if you're talking about what are the causes of Alzheimer, there is one first-degree family history. This is called the deterministic gene. This is autosomal dominant. So once one of your family members have this gene, 50% you're gonna develop this gene sooner or later. And this represents only 1% of the cases. So family history, early onset before 65, you do the gene test, penicillin 1, penicillin 2, it's very well-known gene. Once you get it, so you know that 50% chance you will have it. You will do genetic testing, you have it, so you'll develop it by age of 55, 56 maximum. And it has a very, very, very bad prognosis. So actually the lifespan of Alzheimer's disease range between 5 to 7 years. But if you have this gene, which is a very strong one, you will have between 2 to 3 years, and it's very amnestic, very behavioral disturbance. So mostly it's bad prognosis. But bear in mind, it's only 1% of the cases. The other 99% of the cases were related to what we call risk genes and risk factors. So if you have it, it doesn't mean you will develop disease, but you carry risk. These genes is called ApoE genes and a lot of other risk factors. So deterministic gene is only 1% at very early onset, and then genetic risk factor represent the rest. It's mainly called ApoE4 gene. This apolipoprotein, there are 3 variants of it, 2, 3, and number 4. 2 and 3 are the healthy one. 4 is a sticky one. The one that tend to form clumps in the brain. So if you have 1 copy of this E4, you have 3-4 times chance to develop Alzheimer. If you have 2 copies, it's 12 times. 25% of the people, of those 100 persons sitting in this room, 25% will have 1 copy of this ApoE4. That doesn't mean that you'll develop schizophrenia, but Alzheimer, but it means that you're carrying the risk. So now if someone has this 1 copy, so there's 3-4 times higher chance to get Alzheimer. And if you have one of these risk factors, your risk of developing Alzheimer is increasing. So if someone have lower level of education, deafness, hypertension, smoking, obese, depressed, physically inactive, diabetes, each one of these risk factors carries the risk 10% more. So if you're having already 1 ApoE gene, 1 copy, 4 times, each of these factors will add 10%. So every one of you can check how many risk factors he's having, and this will increase the risk factor. So it's not an easy thing, it's a game. And it's building up and piling up, so it will increase your risk of developing the disease. So actually what happened in the clinic, that we're having a patient mostly coming with his relative at age of 65 or 70. And when we asked him in the clinic, why are you here? He said his symptoms started 2 years back. So he already came late to us, okay? So what we usually do, we do screening, many mental scale examinations, and we do radiological imaging for the brain. And this is accurate by 70 to 80% to diagnose Alzheimer's disease. This was enough before, but now it's no longer enough. We have to do more. So the patient comes to the clinic and we do this many mental state. It's very specific and sensitive. It's about 11 questions. We ask the patients and the relative these questions, and the score comes out of 30, out of 30. It takes around 15 minutes. We ask the questions. If the patient is highly educated, 24 and above, he's in a good hand. Low level of education, 21 is good. But below that, you will think about Alzheimer, mild, moderate, and severe. So from 18 to 23, it's mild Alzheimer. From 8 till 18, it's moderate. Less than 8 is severe Alzheimer. We cannot do anything about that. So the first thing we do, the Many-Mental Scale, we take history from the patients, and then we go for imaging studies. Normally, we don't go further. We just stick to the structural MRI. We don't look about the general atrophic changes. We look immediately at the medial temporal lobe with the red arrows and the hippocampal atrophy. So if you have low Many-Mental Score examination, and we have this radiological finding, so this is accurate around 70%, yes, I'm sure it's Alzheimer dementia. If you have to go further, you will go for glucose metabolism. The blue line says this is normal glucose metabolism. The line down there, this is severe hypometabolism. This is very characteristic in Alzheimer. Then we go to the more specific one, which is PET scan, and it shows you how the amyloid plaques are precipitated all over the brain and mainly in the medial temporal lobe and hippocampus, while in Alzheimer, it's all over the brain. Excess deposition of amyloid plaque. Again, when we see this case, it's too late to start anything, and this was enough for us. Okay, he has Alzheimer, we start the treatment. The response rate to the treatment is 1 of 2 patients. So whenever we start anticholinesterase inhibitors, we know that 1 of 2 will get benefit. He will never recover, but will slow the progress and the behavioral symptoms. But now it's mandatory to do blood workout. Why? Because there is a new treatment coming out in the market, immunotherapy for treatment of Alzheimer. And in order to start the treatment, you have to make sure there is amyloid in the system. So it's not a matter of a choice. You have to offer to the patient the new treatment. We have to do these blood works. And if it turns out to be positive, we'll take you to the next level. So what are the blood biomarkers? Gold standard. It's available in the United States, available in Europe, and it's available in UAE. The thing about these blood works and the immunotherapy, it's beneficial only in the early stages and mild. So when the patient comes after 2 years, it's too late. So if you start having mild cognitive impairment or memory problems, you go to the doctor, he done these tests, then your chances to go into this treatment plan will be high. So what are the gold standard? Tau2, 100 to 117. Again, if you have this test positive, it doesn't mean you have Alzheimer. But if it's positive, with positive Many-Mental Scale, this is very accurate one, and yes, you have Alzheimer. It has preclinical tools. So if someone of you have a family history of Alzheimer and you are in your mid-30s, you're worried about something, you start losing focus and concentration, and you want to just check, you can do this test. It's not diagnostic, but it tells you that something is wrong here. And when it tells you there's something wrong here, you have to check your risk factor and try to manage it before it's too late. So it's actually, it can detect pathology up to 20 years before the clinical onset of dementia. It's predictive risk, 90% chance of becoming cognitively impaired within 10 years. Not a guarantee positive result indicate a highest risk, but it does confirm future diagnosis of clinical dementia. So now we can diagnose Alzheimer 10 or 20 years before it develops, and to protect yourself and to manage your risk factors. Another one, pre-celebrity Alzheimer disease 2. As I said, there are many types of amyloid precursors or amyloid beta in the body, 42 and 40. And it manages the score and see how it's ranging. And again, it predicts how your chances of developing Alzheimer's disease in the future. And the last one, this is for general practitioner in their clinics. The patient comes, he said, I have mild cognitive impairment. Can you help me with that? You will do lots of tests, but this one, Alexei, beta 181 is somehow it's not standard diagnostic, but it's good for screening. So if you have positive test, you have mild cognitive impairment, we can go further for other tests and we'll see if you are eligible for the treatment or not. So now these 3 tests are gold standard. They are available everywhere. You can send the sample for MCI and then you can decide. So Alzheimer's disease specific biological drugs require confirmation of beta amyloid pathology before treatment initiation. So you have the symptoms, you have the biomarkers, then you start the treatment. What is the treatment available? This one, Adolham. It's immunotherapy. It has a very nice, interesting story. It was running into 3rd phase of clinical trial in 2019, and it failed in the 3rd trial. It's failed. It proves non-effective. And actually, the Biogen pharmaceutical company said, okay, we will stop the trial. After a few months, they said, okay, no, it's effective, but at higher dose. Okay. And they tried to convince FDA to approve it by that time. And there was a lot of confusion in the FDA committee. 3 of these people were working in a Biogen pharmacy itself. And this is a major conflict of interest. And 3 were working in FDA and they resigned. But somehow something happened and this medicine got approval in 2021. Okay. First, initially it was approved for all types of dementia, mild, moderate, and severe Alzheimer. Later, they said, no, it's only effective for mild Alzheimer dementia. But so far, it's the only available treatment for Alzheimer. It's immunotherapy. It either activates immune cells to ingest excessive amyloid in the brain or increase the clearance from amyloid from the brain. It's not a treatment, but it will slow the progress of the disease. But we have to know, again, it's for mild dementia and it comes with lots of side effects. So if the patient goes to this treatment, it has to be in the ICU. It's given every 4 weeks for 3 or 4 months. Okay. And we have mandatory to do MRI brain because it causes edema and hemorrhage. So not everyone will accept that, but it's your role to tell the patient there's a new therapy, you have mild, you're a very good candidate for it, let's try and do it. The efficacy, the phase 3 trial, still nothing is well known about this drug, but it's in the market now. And it's a new AE now. The thing about these biological markers now is that you as a person, you can know if you're going to develop Alzheimer or not. But actually, how many of you will go for screening for his mental capacity? We all go screening for cancer, breast cancer, colon cancer, but nobody goes for screening for Alzheimer dementia. Maybe if you go screening early, you can start treatment or you can modify your risk factor. But this is so far is not happening. So actually now they are doing what we call digital healthcare technology, smartphone applications. This is application, you download it in your phone if you're having a family history, if you have memory problem or something like that. And this is well track your memory performance, your executive function performance, your recall ability. And then by using it, if you feel there's something wrong, it will give you hints. You have deficit in this and this and this, you have this kind of risk factor, and according to that, you can go further to more specialty to help you with that. So it's still in the process, it's still not approved, but it's proving now in the studies, in the preliminary study, that it may be helpful for a patient who's having family history. So simply, these kind of questions, you will have it in the app. First, you take demography, how old are you, what level of education, what certificate you're taking, what are the risk factors, any family members. And then it will ask you lots of questions. For example, the first one, verbal fluency, will ask you, tell me how many words in 90 minutes, starting with the letter C or A. And so you have to write it down or to memorize it. Or tell me how many cars, this category, semantic memory. And a lot of other questions to give you at the end, your score. Yes, you are on the right track. No, you are not on the right track, and you have to do something about it. So semantic fluency, phonemic fluency. There is a breeze test, which is a verbal memory. You first screen, you will just memorize some sort of stuff. And then to prevent rehearsal, we detecting recall, not memory. So to prevent rehearsal and forming a memory, we'll give you math test in the middle, and then we'll ask you, can you memorize the things again? So this will be through the app. And by final end, and there's a connecting dots, level 1, A, B, C, D, E, level 2, A1, B2, and level 3 will give you the same sequence, distracting, and you repeat again. So it's a very well specified test that will help you and will test your memory. And by doing this, and we figure out the numbers are not that great, then we'll do the blood biomarkers, which has a predictive ability. And by these two things, we will tell you, you have to take care about your risk factor. We have to manage, stop smoking, lose weight, eat healthy, start reading more, educate yourself, exercise. This might minimize the risk, but it won't prevent it totally. It might delay it a little bit, still under investigation. But the key point of this lecture, now we can definitely diagnose Alzheimer. We can diagnose it even before it starts. And thank you.